In fat removal, we have lots of invasive techniques that we've used for years, such as liposuction. And it's a very effective way of removing fat where you don't want it, and through very small, tiny incisions with cannulas. And the advances in that of recent have been the addition of power-assisted liposuction, which enables you to get out more stubborn fat, such as the back, or in men who have fat on their chest. We call it gynecomastia. And then also laser-assisted liposuction and radio frequency-assisted liposuction. And those are techniques that help theoretically melt the fat and or tighten the skin as the process is evolving. The newest fat melting technique is a machine called Vanquish, and it's a radio frequency, non-invasive, which means it's no cutting, no sewing, no real recovery, in fact. And it essentially is for the trunk and the legs, and it works by radio frequency, which heats up the fat to a melting point, and so the fat essentially explodes, but sort of gently. So it doesn't hurt, and then your body processes that and eliminates it. All that you feel is that it heats up your skin to about 94 degrees, and then it heats the fat to a slightly higher temperature, targeting just the fat, so it doesn't target your organs or anything else. And it's not painful. All you feel is a little bit of heat, and a series of usually 4 treatments, waiting a week in between each treatment to allow the body to sort of process the fat and excrete it. And then we found that this also has a skin tightening effect. Well, it's a good question, and I don't know what exactly the end point is, but it's really ideal for people who are sort of not obese, maybe a little bit overweight, close to their ideal weight, but have a stubborn area that they can't get rid of. For most men, it tends to be the love handles, and for a lot of women, it tends to be the outer thighs. So there are different attachments to this machine that can be used for either the trunk, so meaning the stomach, or the back, front and back, and or the legs. People who use this in conjunction with diet in a period of a month have lost as much as 10 pounds. If you do nothing but this treatment, you don't change your lifestyle whatsoever, you continue eating as you were, most people lose 2 to 3 pounds, which is not bad considering you are doing nothing other than showing up for a treatment once a week. It has been really popular, and I think one of the things, there are other techniques out there that are non-invasive. One of them is called CoolSculpt, which is sort of the opposite. So CoolSculpt is a freezing method of essentially destroying the fat, and that is effective. It absolutely works. It's a machine that sort of takes a squeeze of your fat and skin, and that goes into this machine for about 30 minutes, and it freezes it. But the machine is about this big, so it can only hold that much skin and fat. So let's say you were going to do an abdomen, you could imagine 1, 2, 3, 4 spots, which would then translate to 2 hours for a treatment. And again, you need multiple treatments, just like the radio frequency. So it's a slower process, and the freezing component of it is uncomfortable. It's just like if you ice something for too long, it's not a very comfortable feeling. The other downside of the CoolSculpt is that it can harden the fat. So part of the freezing, it actually can harden the fat, and then it will eventually soften and dissolve, but there could be a period of months, maybe even 6 months, where that area feels quite firm. And with the radio frequency, we don't see that.